you all here today. Thank you so much for making time out of your busy schedule to be here today to talk about an issue that doesn't often get enough attention in our field, which is how to ensure equitable access to early childhood education, whether that's childcare, pre-K, Head Start, or some other iteration of that. That's what we're here to talk about today, because we know that while we have a lot of data, good data, right, about the millions of kids who access these programs, we really need to also understand who does not have access, who faces barriers to access, and how can we as a community step up and remove those barriers. So that's what we're here to talk about today, and we have wonderful experts to guide us through this conversation, as well as some new research and a report from NHSA we're excited to be sharing with you. So before we get started, I want to do a little bit of thanks to Voices for Healthy Kids with the American Heart Association. They're a wonderful organization that helps to improve the lives of kids all across the country, in particular by promoting policies focused on equity, including health equity. As many of you know who are familiar with Head Start, early Head Start, strong health equity impacts for that program, as well as early childhood writ large. So again, thank you to Voices for Healthy Kids. NHSA, just a little bit about us. Our vision is to be that untiring voice for every vulnerable child so that they can be served by the Head Start model of support for the whole child, family, and community. And we do that through a lot of advocacy work with our huge and passionate community of supporters, as well as partners all across the early childhood, health, justice, and other sectors. Our mission is to coalesce, inspire, and support the Head Start field as a leader in early childhood development and education. For over 55 years, Head Start's been that voice and that leader. We try to maintain that legacy and build on it as well. So just a little preface as we get started here before we turn to our panelists. I think all of us know you almost can't do a presentation without saying this though, which is that we are in the midst of really unprecedented change, at least in modern times. Pulled just a few headlines this morning that I think illustrate that change well, from many parents ready to go back to work but lacking childcare, the huge and almost unprecedented upheaval we've seen in our workforce, fortunately high levels of employment, but also a lot of resignations, burnout, et cetera. And of course, our children. We have to always pull it back to our kids. How are they doing? How are they faring? And after 2 years, I think it's really a mixed bag. And a lot of kids are still struggling with traumatic issues, with mental health and other concerns, as are many parents and vulnerable families. So wanted to, of course, give some context to this times that we're in. And I think it's also really important to note, and I was thinking about this as I came into the call, Congress made, the federal government in particular, and some states made some unprecedented investments to combat the public health crisis, to protect families from falling into greater poverty, to assist displaced workers. These things were tremendous progress, but we're seeing backsliding. We're seeing backsliding, and unfortunately, that's a lot of the history of our country, that after gains, structural inequality, racial inequality can surge. And we're seeing some of that again. So we're seeing more children falling back into child poverty as the child tax credit, expanded child tax credit expires. Of course, leaders in Congress are still working on that, and our communities are still working on that. We're also seeing inflation, obviously rising to times that at least I haven't seen in my adult life. And we know that that hits poorest families the hardest. They're the ones who are going to look at the gas pump and go to the grocery store and see those changes more than someone like myself, right? And so that's very much top of mind, that we have made gains post-pandemic, and we're at risk of losing those as well. And I think that's where we all, of course, come into this equation. Knowing what we know about child development, about family support, we know that accessible, high-quality early childhood education is more necessary than ever. I love this graphic from the Build Initiative because it keys in on the wide diversity and range of early childhood settings that are so critical, because there's no one-size solution for all the communities and all the needs that we see across our country. So we know we need to continue to fight for and press for investments in early childhood education of all kinds. So just to pick out a few of those settings, one, Head Start, of course. So I'm with NHSA. So, Head Start is essential. Head Start has over 17,000 centers nationwide, 841,000 slots, and serves a real diversity of children, as you can see, all across the country, coast to coast, and in between. So, of course, Head Start remains an essential part of this landscape. The model of Head Start and early Head Start remains relevant, and especially relevant today, with its holistic focus on children, on families, and on communities, whether that means helping kids access preventative dental care or working with families experiencing homelessness. So many great things that our community does. And for those of you in the Head Start community joining us today, thank you for all that you do. Your work is important. Your work is meaningful. Childcare is essential. I shared that headline earlier. Obviously, we have a lot of parents, primarily women, who want to go back to work, but cannot find affordable, high-quality childcare. And that can mean a lack of family economic mobility and opportunity. It can mean children in substandard care or no care at all. It can mean higher risks for those children. There's a lot of ripple effects from not attending to childcare. And of course, we continue to hope and advocate for a major investment in childcare from Congress and from states as well. I just pulled a couple CCDS statistics here around the number of families served, nearly 1 million, and the reasons that families pursue those subsidies and childcare subsidy, of course, to advance their own family, their own education, their own job training. So critical reasons. Home-based childcare is essential. We're really lucky to have an expert in home-based and family childcare on the call today, Natalie Renew, who you'll meet later from Homegrown, and just pulled a couple photos. I love photos of family childcare and home-based childcare because you can just see the warmth and the love and the care that providers have put into their setting. And for any of us who have been in those homes, you can really feel it when you're there too. It's very unique, it's very caring and loving, and it's a critical part of our ecosystem, especially for low-income children, as we'll learn today, children who face barriers to access, whether that's transportation, linguistic, cultural, etc. Huge part of the solution moving forward. Excited to explore that with everyone today. Pre-K remains essential. Pulled this graphic from NEAR, and many of you know NEAR does a state of preschool report. They're coming out with their new one next week, so look for that. Very excited to see that. Unfortunately, it does have some news around enrollment that's not encouraging. But that's to say, states have done a lot of investment in pre-K. We're looking for even more investment, hopefully, in the future in pre-K, because school readiness is so essential to a child's success. But let's turn to the issue of access, right? So what if access were denied? What if this family, what if these children, what if that child had never found their way to Head Start, to pre-K, to childcare? What would that mean for their trajectory, for their family, and for their life? And so to bring that down, I think from the macro level, big statistics, millions of children, I like to focus on one particular story. We've collected many stories in the last year about early Head Start and the impact it has on children and on families. And I like to share about Galena. So Galena is a mother of two from Seattle. She herself has autism, and she signed up for early Head Start when she was pregnant with her first daughter. So some of you may know early Head Start also does prenatal work, not to the same extent it does center-based and home visiting, but it is an option for early Head Start. And one reason she did this was she was really worried. She was worried that someone would try to take her children away because of her autism and wanted someone to witness and to support her parenting. And I love this quote from her because it really shows the power of her engagement with a high-quality early childhood program. She notes, "I've been able to leave the children at school and complete medical treatments I needed. I've been encouraged to broaden the activities our little family does together. My husband and I are spending more time together. I'm also starting a business that may someday pull our little family out of poverty. All of that was helped along by early Head Start." So it's a wonderful success story But I want to get a little interactive here with the audience. And so I'm going to pull up the chat here and monitor the chat. What could have gone wrong here for Galina and for her family? What are some of the barriers you think she might have had to overcome, barriers she might have faced as she was working to enroll in early Head Start, access the program, thrive in the program? Go ahead and put some of your just brainstorm thoughts. What are some of the barriers that could have gotten in her way, could have gotten in the way of this success story? Being waitlisted, thank you, Lataya. The program was already full, not knowing about it, not being able to afford childcare, absolutely. Social emotional skills, didn't qualify, that's a big one, not knowing who to call, not having documentation, absolutely. Lack of education about how to reach it, not being able to get to the program, that's a big one, that's a big access barrier. Transportation again, huge topic we'll talk about today. Fear of judgment, that's huge. Imagine the courage she had to have, right? And resilience she had to have. Income guidelines, absolutely. Great thoughts. And I think that really shows the expertise also of the audience we're with today, knowing that a lot of those are barriers we're going to talk about later today. So today's goals are really to learn and do three things. One is to learn about some of the relevant frameworks and research from leading access to early childhood scholars, and thrilled to have some of those folks on the call today. The second is to digest a new report from NHSA, a big field survey, big process, 12-month process we've done to renew our understanding of barriers to access for Head Start, early Head Start, many of which are shared across the early child community, but some of which are specific to Head Start. And also finally, to discuss solutions. We're not just here to raise the problems. We have folks on the call who have wonderful ideas about policy solutions, and NHSA will share some of our own as well. So with that, I want to get right to our experts. I'm so honored to have these three folks on the call, folks I have worked with, had the honor to work with in the past, and hope you'll welcome them in the chat with me today. So first, Catherine Tao. Catherine is the Vice President for Early Childhood Research and Partnerships at Child Trends. And during her 25-year career at Child Trends, her research, evaluation, and TA have focused on identifying best practices in early childhood system building, program quality improvement, and professional development for early childhood educators. She currently co-directs 2 federal contracts and works locally on research projects in her home state of Minnesota. And her goal is to build capacity in the field for continuous improvement that supports equitable outcomes for educators, families, and children. Catherine, welcome today. Next, I want to introduce Erin Hardy. Erin is a senior research scientist in the Education and Child Development Department at NORC, conducting early childhood research, including work that is responsive to cultural and linguistic diversity, disparities, and equity issues. She has over 15 years of experience conducting applied quantitative policy research in the areas of early childhood care and education, child health, and K-12. And her research focuses on structural drivers of inequality in children's developmental context, access to opportunities, and how to account for these connections in the analysis and development of U.S. social policies. And we've been thrilled to use and digest her research on Head Start in specific. So Erin, welcome today as well. And finally, Natalie Renew is the Executive Director of Homegrown, a national initiative committed to improving the quality of and access to home-based childcare. She is an early childhood professional with more than 15 years of experience in the nonprofit and social service sector, supporting children and families furthest from opportunity. Prior to joining Homegrown, Natalie led the expansion of the Early Childhood Education Group at Public Health Management Corporation in Philadelphia. She has overseen the development of large programs, secured sustainable funding for major initiatives, and supported local system change in the early learning sector. Early in her career, she worked in child welfare and food access. She's a wonderful expert in this sector and on home-based childcare. Natalie, welcome today as well. So with that, I am going to stop screen sharing, and we're going to turn it right over to Catherine from Child Trends for her presentation, which is a great overview and framework to guide us as we deepen our understanding of barriers to access. I think we're looking for, do you need assistance with unmuting, Catherine? There we go.
Thank you. I'm so sorry. I am trying to do something too fancy on my screen and it was not working. Can you all see my slides? I'm sorry that for the long delay in getting on video. Can you see them, Kent?
Yes. Mm-hmm.
Okay, perfect. Well, thanks everyone. Sorry for that long extended intro to my slides. My name is Catherine Todd. I'm so honored to be here with you today to talk about the work that our team has been involved with at Child Trends on centering families in measures of early care and education access. And as you heard from Kent, my perspective on this topic is as a researcher. So you'll hear a lot about how we think about, conceptualize and define measures of access today. But I hope that this is helpful for you in thinking about how this applies to your work, whether it's in research or in direct service with families or in administration of programs. This is helpful for bringing a base for us to understand access. I'm really delighted that our work has been funded by the Office of Planning, Research, and Evaluation in ACF, the federal ACF, and we have been funded through a contract for a number of years, which really sparked this work on access. And I want to acknowledge Evelise Martinez-Beck and Shannon Warren, who are currently overseeing the work that we are doing on access at Child Trends. And I'm also really excited to say that this work that started with our OPRE projects has expanded and blossomed to many other projects that we're doing at Child Trends. And I'm also just so proud of our large team at Child Trends that has been doing the work on access, beginning with thinking through the definitional issues and indicators, but now even bringing it to life, working in technical assistance with coalitions and helping them identify the barriers to access that they see in their own communities or in their own programs. So thank you to the names on the screen. I know Sarah Daly and Ashley Hiralal are on the call with us today, and hopefully will be helping me address any questions that we may get today. So just as an overview, where we'll start, I want to just share about this measuring access and the ways that we've been thinking about that from the perspective of families. And I'll share some of the indicators and data that you can think about and that we've seen the field thinking about in the ways that we've measured access. And then I'll share just some thoughts about what does this mean for Head Start? What are some of the ways that we could apply the access definition in the Head Start context, but truly in any of the contexts that we talked about that Kent mentioned at the beginning, the pre-K or childcare context, just thinking about some concrete ways that we can think about access in those contexts. And then I'll share some next steps. So as I kick this off, and you've heard me say this term multidimensional, which feels daunting and feels like it's going to be a complex topic, which it is. We know access is a complex topic. So I wanted to just make sure to say, I hope that by the end of this presentation, that you have two takeaways. And the first is that yes, it's overwhelming to think about multiple dimensions, but it's critical. When you were listing those dimensions of access that could have prevented Galena from accessing that early Head Start program, we all know intuitively that access is complex and that the ways that families experience it can't just be summed up with one single indicator. So access is multidimensional, and it's okay for us to say that. It's okay for us to acknowledge, and it's in fact, the second thing to take away is it's our responsibility to think about access from a family's perspective and to acknowledge those multiple facets of access that impact the way that they can choose care and make their decisions about where their child will be cared for. So those two points, keep those in mind as we get into the complexities of how to measure and define access. As a researcher, I come to this discussion with the assumption that if we're going to improve access, we need metrics. We need actionable metrics that will help us understand the needs and the abilities of families to access care that meets their needs. Really importantly, those access indicators can help us monitor and track progress over time, and they can help us make comparisons within or across different geographies. So we know that measures are important, but they're hard. They're hard. It's hard to come up with measures that can capture all of those dimensions. So as you go through today, I would love your thoughts in the chat as we talk about each of these dimensions of access to share some ideas. I just loved some of those that you were sharing earlier, and we can share as we get specific about the dimensions of access, some ideas you have for what are we missing in our definition so far, and what more do we need to know? So the most common access metric, and one we hear about a lot, is the number of children relative to the number of childcare slots. And this is particularly a way we have looked at it in childcare and CCDF funded childcare. And kind of the simple way of thinking about that is how many tots per slot. One very helpful metric or overall frame for looking at tots per slots is the childcare deserts. And you've likely seen some of those maps that very starkly show where we see a lack of supply, where we see a lack of slots for families in particular rural areas, or maybe even in particular neighborhoods. So we know that this desert concept is really, really helpful. But we also know that it's not enough, that there's a limit to the way that tots per slots helps us in our conceptualization, our understanding, because we know that not all slots are available to all families. They may not be easily found. They're not affordable. They're not offered during the times of the day that families need them. They don't offer support services or coordination that children and families need. They don't acknowledge the preferences of families. And so we know that if we only used tots per slots, and even then we know we still see low access in areas, but believe it or not, we can actually be overestimating access if we are not taking into account the complexity. So a family-centered definition of access acknowledges that complexity. And you can see it here on the screen. This is a definition that was developed by a panel of research experts and state leaders to acknowledge these multiple dimensions of families' experiences. It says that access to early care and education means that parents with reasonable effort and affordability can enroll their child in an arrangement that supports their child's development and meets parents' needs. So you're going to see these phrases show up throughout the rest of my presentation. This definition can be used to develop metrics and share data across these dimensions. And it shows us that there isn't one simple metric, but it allows for multiple indicators and perspectives on access. So let's take just a quick closer look at the kind of question that we ask that's different. Does the supply match the needs and preferences of families? What are their needs? What are their constraints? And how do we build a supply that better meets their needs and preferences? It allows us, this definition in this frame allows us to ask questions in a different way. So here's a visual that we developed to help understand these 4 dimensions. They are reasonable effort, affordability, supporting child's development, and meets parents' needs. And as you're looking at those and reading some of the text, we don't need to go through, there'll be many other examples in the presentation, so you don't need to read that smaller print now in depth. but just to provide this perspective on the multiple dimensions and to know a couple of key things. One, they are not mutually exclusive. Some of these dimensions, something that meets parents' needs might absolutely also support children's development. Something that helps with affordability may also meet parents' needs. So we are not thinking of these as very strict, mutually exclusive dimensions, but as dimensions that help us just put a frame around the complexity and give us some language to help us capture the multiple aspects of access that families encounter. This work was originally published in a document in 2017 for OPRE, as I mentioned earlier. We have been considering many important updates to this work and are in the process of doing that now. So one key factor that is not included in this guidebook from 2017 is equity. We didn't name it as a specific dimension. And as we've been conceptualizing the work since 2017, our next iteration will show how equity is embedded within each of the dimensions. So please stay tuned for these updates to the framework. I want to just spend a little bit of time giving you a lay of the land for what we've seen in reports across childcare, Head Start, pre-K, and the ways that the access has been measured and reported on for policymakers, for researchers. And this work comes from a literature review that was led by my colleague Dana Thompson. And just a couple of key things to take away from that review. First, we often think about, we see measured in the field, a systems level look at access and a family level look at access. So the system level is thinking about factors such as on the supply side, the supply of care, such as availability and cost. Whereas the family level perspective is about the demand side factors that relate to characteristics of families and issues related to their family needs. What we learned when we took a look across the many different reports that have been published, this was done in 2020, so it does not include recent reports from the pandemic, but a wide range of research showed us that most analyses are from a systems perspective. They take into account those supply side factors and they don't address those really critical family level factors. So they don't talk about access in terms of whether it meets families' beliefs and attitudes, whether the care available is breaking down some of their barriers, such as transportation or languages. So broad takeaway here is that we lack family level data. Our current measures of access really look primarily at a systems level view. And just to walk through each of the dimensions so you get a little bit better sense of what is included there and what we see coming out of different reports across the country. Reasonable effort really comes down to, in measurement, availability. So of course you need sufficient availability for families to access care, and that we see that addressed in many reports. Also geographic location, so whether it's near parents' homes or workplaces. There's much less, however, about the availability of information. That was one of the things a number of you put in the chat about Galena. Did she even know that it existed, that early Head Start program existed? So there is much less of a focus on the availability of information on this dimension, reasonable effort dimension. When it comes to affordability, there are a number of aspects here that we wanted to take into account. So the availability of subsidies or other financial assistance, and really importantly, the cost to the family of care. And we see very few articles or research reports on access that take into account that important dimension of, is this something that fits within a family's income or that they can afford with their resources? For supporting children's development, there are quite a few reports on access that look at administrative factors, administrative data such as quality ratings, so that take into account the quality of care. But when we start breaking down that care into features that support children's development, so do they have access to specialized services, Or are there slots available for children who may have special needs? We see much less in the field that addresses children's specialized needs or the needs, for example, of dual language learners. So we've got those ratings, got that set, but we don't have this further detail. And then meeting parents' needs. We see a lot of information in our access measures about provider type, much less about hours of operation, for example, and think about how critical that is when we know so many parents are working non-traditional hours or need care different times of the day. And then finally, as we think about equity and how we might look at some of the characteristics that impact or that are related to each of those previous dimensions that we just looked at, we see primarily a focus in access reports on income, a little bit of a focus on race, ethnicity, but much less of a focus on other characteristics of families, their linguistic preferences, their urbanicity, whether they're immigrants, and parental structure, family structure. So we know that there is much more that can be done to understand the needs of families by their specific characteristics. So I want to share just some thoughts about how this access definition might be applied to Head Start. I'm really curious about your thoughts on that, on these ideas. First, we think that, let's see. Okay, sorry about that. The access definition is one that could be very helpful as we're thinking about conducting community needs assessments. So we know that it has this, it's family centered, it's looking at access from a family's perspective. And because these community needs assessments are looking at local conditions, it works really well if we think about what is the local context and how does that meet families' needs? Where are families currently what are they currently using? Where are they located? What are the characteristics of transportation and employment in the area? How do those impact the use of care? And this important issue of information. What information do families have available? How do they learn about Head Start and early Head Start or other types of care? And as we think about this, and to start developing metrics and goals, because this is, we know that's the reason we would hoping to find these metrics is that we can look at them over time and establish some baselines and look to see if we're getting better and improving access. We need to ask a few questions about the families that are going to be included in these assessments in our assessment of access. So how are we going to think about characteristics? Do we want to look at access for all families in a geographic area, for families with low incomes, or for only families meeting Head Start and early Head Start eligibility criteria? What about the age of their children? So families with children age 0 to 3 or age 0 to 5, and making those important decisions about how you're going to assess access for those different groups and understanding that we might see very different patterns depending on the age of children, or as we talked about, their income and whether they might be slightly over that eligibility criteria for Head Start. So we know that we want to develop these metrics and goals for access, but we also need to be really mindful about who we're including in those metrics and in the measurement that we're doing. We also want to think about what new data we can collect. Can our data be disaggregated by race and other high priority characteristics? But also, can we think about new data that can be collected to understand families and their experiences? Okay, so that was a whirlwind tour through some of the access work that we've been doing in the multiple dimensions. I hope you're finding those dimensions useful in your thinking and sharing about those, how it might be useful in your own work. I wanted to just share some updates on how we've been using the access definition in a number of other reports and analyses. And actually, as you can see here, we have looked at it, the access definition and how it applies in consumer education websites, which is the CCDF requirement. We've been using secondary large data sets, such as the National Survey of Early Care and Education, to conceptualize these measures of access and think about it from the side of the system and from the side of families. And we've also been using it to assess different policies, using the framework to ask questions about, is this policy addressing the multiple dimensions of access? Have we left one out? Have we forgot about meeting the parents' needs or making the access being able to be found with reasonable effort? So our team has been using this not only for needs assessments and reporting, but also for technical assistance. As I mentioned earlier, we've been using the definition to help communities and coalitions think through what some of the barriers to access are in their programs, and having them walk through those multiple dimensions and really engage families in conversations about the dimensions and understanding it from their perspective. So we're currently involved in some, as I mentioned, a new literature scan and engaging researchers, thought leaders, staff, and parents from early care and education programs to update our access definition and continue developing further guidance. So I look forward to your thoughts in the chat or in questions about this measurement framework, and any ideas you have for how we might improve it or some ideas for how it could be applied. Thank you.
Great, thank you so much, Catherine. If you want to go ahead and stop screen sharing, then we can transition to Erin here. First, I want to thank you and your team for such a thoughtful framework, and one that really does bring a lot more nuance to these questions. A lot of things really resonated with what we found recently, particularly on the family side, and look forward to sharing more about that later. So now I'm going to turn over to Erin Hardy, who has done some amazing work on neighborhood-informed approaches to advance racial equity and many other areas. So Erin, take it away.
Great, thank you. Thank you to everyone for having me here today. I'm really excited to have an opportunity to share a lot of the work that our team has been doing over many years. And just want to echo what others have said about thanking everyone in this virtual room for the work that you're doing. And this is such an important time for early childhood. And so there's a huge division of labor around this work. And I just want to express appreciation for everyone's efforts. And also want to thank Catherine and Child Trends team and OPRE for working so hard to develop the access framework. It really has become an incredibly powerful tool for the field. And I think has been a really helpful bridge to have a common language between kind of research, analysis, policy, and practice, where we can take this really complex concept of access and break it down into its component parts and all figure out the piece of that work that we need to do. And so I just have a lot of appreciation for that. And you'll see how this work that our team has done connects to the access framework. So I'm a senior research scientist at NORC at the University of Chicago, and I'm also an affiliated scholar with the Institute for Child, Youth, and Family Policy at Brandeis, where a lot of the work that I'm going to talk about today began. Now that I'm at NORC, I came recently last fall to NORC, and working to help apply the research that was done over many years, helping sort of federal and state agencies think about ways and approaches to apply the work. So one of the dimensions that Catherine talked about was this dimension of reasonable effort. And a big part of that dimension is this idea of local availability. And that can sound very jargony, but I think it's important to go back to Catherine's concept of family-centered. So before we start talking about neighborhoods and structural inequality and segregation and a lot of macro concepts, and I will be showing you a lot of statistics, but I hope they're interesting statistics and informative ones. I do like to stay grounded in the family perspective of when we talk about neighborhoods, we're not talking about counties, we're not talking about their state, we're not talking about even really their city or town. We're talking about when the family walks out their door in the morning, what are they surrounded by? So that really, really proximal area that is close to home. So in terms of agenda for today, I want to zoom us out very quickly to put us in the larger context of where we are in terms of access to key ECE programs in a larger racial equity context, and then zoom us back into kind of how neighborhoods, issues of ECE access, how that relates to racial equity. So we'll zoom back in. I always like to start with some definitions. Equity is not about equal, rather that children, sorry, I'm having trouble here. I've got a lot of things, sorry, on my screen. Equity is not about equal, rather that all children have their specific needs met. Equitable access means the absence of systematic unfair disparities between population groups in terms of their access to opportunities for healthy development. And then equitable approaches address the ways that those structural factors, things that are outside of the control of any individual child or family, things like segregation, shape two things. One, children's access to key programs, but also how it shapes their needs and their vulnerabilities, and how those get shaped differently along racial and ethnic lines. So this will not be new information to many in the room, of course, but just a good reminder of what we're working towards and kind of where we are at relative to our aspirations. So at the population level, we have sort of consistent and persistent data telling us that children in certain racial and ethnic groups, Black, Hispanic, American Indian, immigrant children, arrive at kindergarten behind in a range of core academic and social readiness skills for school. This also goes without saying, but it always bears repeating that we see population level differences by the time kids get to kindergarten in terms of their preparedness for school and their developmental outcomes, but we don't see any of those differences when babies are born. We don't see any racial and ethnic group differences. So it's what's happening from the time babies are born till the time they go to school. It's about our systems, it's about our opportunities, it's about our structures that are shaping these very different trajectories for children on the basis of their race and ethnicity. Why do we care so much about school readiness and kindergarten entry statistics and all the things that happen in birth to 5? Again, I'm in a friendly audience here, but again, when we look at a range of different inequalities later in life. So here we're just thinking about 4th grade reading. The gap between white children and Black children and white children and Hispanic children in 4th grade reading, for example, has been declining over time. And that decline is largely driven by declining gaps in school readiness. So it's less about what's happening after kids get to kindergarten. So between kindergarten and 4th grade, it's largely about what's happening before kids even get into the school building. And while this is positive, I also, it's helpful to think about where we are, right? So at the rates that the gaps declined, based on that research I just showed from 1998 to 2010, it would take another 60 to 110 years for those gaps to be completely eliminated. So for us to return to where babies start when they're born, it would, if we keep going at the rate of progress that we're at, would take us another 60 to 110 years. So, and then we think about what kind of levels of access. Again, these are very, very macro level statistics. At the national level, less than half of poor 3 and 4-year-olds children that are eligible for Head Start are reached by the program. Only 15% of children who are eligible under federal rules are served by CCDF childcare subsidies. At the current rate of growth in state-funded pre-K, this is a few years back, so it's I'm sure even slower based on the recent results, but it would take 150 years to reach 75% enrollment in state-funded public pre-K. So whatever we talk about in terms of issues of equity, whether we're talking about different strategies, different approaches, this is our larger context that we always have to keep in mind, right? We have this enormous unmet need at the population level that is the big overarching equity issue that we're facing. And one way that's important to think about that I think doesn't get enough attention is that when we have unmet need for kids of different racial and ethnic groups, the burden of that unmet need is very different when we think about it at a population level. So I'm going to try to kind of break this down in a, so let's compare, white children and Black children, for example. So the poverty rate amongst white children is 12%, and then amongst Black children is 37%. So there's a higher percent of Black children who are eligible for programs like Head Start, right? So there's a higher need within the overall population. So if we assumed for a minute that, half of the white kids who are eligible, and similarly, half of Black kids that were eligible were reached by Head Start, then what we could look at is, how many kids are eligible in the population and not reached, right? So those red bars that I just added on show, they're about halfway up for each of these, right? And what you see is that if you think about it for white children, about 6% of the entire white child population is left eligible and unserved, compared to closer to 18% of Black children, which is 3 times as high, right? So we need to think about how that unmet need that we have in our ECE programs is having a much larger proportional burden on certain racial and ethnic groups of children. We're now going to zoom in to this issue of neighborhoods, ECE access, and how and why this is a racial equity issue, and then what we can do about it. So another issue, so we've got this overarching issue of unmet need, and it has consequences when we think of kind of the proportionality, the disproportionality of the impacts of that unmet need at a population level. And then if we just zoom into children that are eligible for public ECE programs, certain public ECE programs. So if we think about low-income children as a group, even within low-income children, we find that children of some racial and ethnic groups are either more or less likely to be reached by public ECE programs. So Hispanic children in particular are the least likely to be reached by Head Start and CCDF. And so that should give us real pause, right? Because both of these programs are targeting children and families on the basis of their income characteristics. Yet we're seeing differences on the basis of race and ethnicity. So this is a clear signal that the barriers that children and families are facing in terms of access are not just about their income, they're about issues of race and ethnicity and nativity as well. What does it have to do with neighborhoods? This has to do with many things. So I want to remind us that we're talking about neighborhoods for today, but there's many layers here. As it relates to neighborhoods, we have a real seminal study that was done in 2009. It was a while ago, but it was a really rigorous study. It was using national data and showed that children who have a Head Start in their immediate neighborhood are more likely to attend Head Start. And by immediate neighborhood, it was their census tract, which is basically the very, very proximal area around where they live. It increases participation, especially for some groups of children, including immigrant children, Hispanic children, and transportation vulnerable children, so kids that had higher transportation barriers. The other thing that we think a lot about with neighborhoods in terms of access to ECE, and we're going to talk a little bit more about this, and I'll show some data to help explain it, is any child or family that's eligible for public ECE is vulnerable and is a priority, right? We know that. Within those children, there are children that are facing different sets of barriers, and in some cases, multiple barriers and kind of accumulative barriers that put them at an even further disadvantage. So one of the groups that we're very focused on is children that face this condition of what we call triple jeopardy. So children that have their family is poor, right? Their income is below the federal poverty line. They're in a neighborhood that has conditions and a lack of opportunities to help them grow, thrive, and learn. And they also have this third condition where those would be children that would really, really benefit from having a high quality early childhood program with available capacity that they know about and that they can get to within their proximal area. So children that lack that as a key resource to help offset their other kind of risk factors are of very, very high policy relevance. What does this have to do with racial equity? What we find is that neighborhood availability of Head Start and lots of different types of early care and education are very variable. We know there's many places that don't have enough. Many places that don't have enough of the type of programs that vulnerable families need. And then also what we find is that can look systematically different by race, ethnicity, and nativity. And I'll say more in a minute about what's driving that. And then secondly, Black and Hispanic children in particular are the most likely to face the triple jeopardy of family poverty, adverse neighborhood conditions, and poor neighborhood access to Head Start. And I'm going to show some statistics on that. But before I wrap up with those, what we're finding from that research, why is this an issue of structural racism, and why does this relate to racial equity work? It's racial residential segregation that is driving these patterns. So we have to keep in mind that segregation is this big macro level force, right? It's a form of institutional racial discrimination. It has been reinforced over decades through exclusionary and discriminatory policies. So we've created segregation through our policies. The only upside of that is that we can, if policies can create this outcome, then policies can confront these outcomes as well. They are avoidable. Segregation is an institutional and systemic issue. And what we mean by that is it's outside of the control of any individual child or family, and it's not benign. It also negatively affects children on the basis of their race and ethnicity over and above factors, including their income. And this is critical because our policies, we ask, there's so much dialogue right now about how can our policies address issues of systemic racism. These patterns and institutional forms of discrimination that are in our policies can only be undone if our policies acknowledge and address those intentionally. So what does segregation look like and how bad is it? I don't know how frequently folks in the room look at these maps. I work with them a lot. And this is a map of the Milwaukee metro area, but I could show you a map that looks like this for really any major metropolitan area in the United States, unfortunately. I think the maps speak for themselves. The neighborhoods where white and Black children live in the Milwaukee area are the complete mirror image of one another. But what does this have to do specifically with low-income children? Because there is, an understanding that, well, maybe some of these racial differences that we're seeing in where kids live are a function of different income levels that are playing out on racial and ethnic lines. It does explain some of it, but not all of it, and even not most of it. So, and that's where, again, it comes back to an issue of specifically racially discriminatory policies that have led to these outcomes. So what I'm showing here is the height of the bar is the percent of residents in the neighborhood that are white. Okay, and that's the same for the two charts. So if I look at all children in the US of all incomes, let's look at white children. White children live in neighborhoods that are 72% white. Black children live in neighborhoods that are 23% white. Okay, so white children's are much more likely to be surrounded by white residents as compared to Black children. Then if we just look at that same statistic, but we look at it for low-income children, we see almost the exact same pattern, right? So this is white low-income children. White low-income children live in neighborhoods that are 72% white. Black low-income children live in neighborhoods that are 21% white. And the other thing that scores and scores of research have now, uncovered is that, this separation between kids of different racial and ethnic groups is not benign. So think about this question: do poor children live in poor neighborhoods? Right? We would think it is more likely that a child that has fewer economic resources may be likely to live in neighborhoods with other families with low economic resources. But the answer to this question is much more likely to be yes if you're Hispanic or Black. So 35% of poor white children live in a high poverty neighborhood. That compares to over 70 and 75% of poor Hispanic and poor Black children. So kind of in wrapping up, I just want to show two kind of last statistics that brings all of those kind of macro level forces and intersects them with local level neighborhood availability of key ECE programs like Head Start. So what we're showing here is we looked at for all children in the US that are eligible for Head Start. So we're looking at children in families below the poverty line. How many other Head Start eligible children do they have in their neighborhood? Okay. And the way to think about this chart is the higher the bar, the worse the access. Because if you have more children per center in your neighborhood, it means there are more children in need of and kind of competing for that center, right? So if you are a white Head Start eligible child, you live in a neighborhood with 59 other Head Start eligible children. If you're a Hispanic Head Start eligible child, you live in a neighborhood with 96 eligible children. And so the difference is about 30 children, which is about the size of, that's the average national size of a Head Start center. So that difference is material in terms of not having enough capacity within Head Start at a very local level. And it's also concerning that the groups that have the worst neighborhood access to Head Start are the same for whom research is telling us that access matters the most. So certain groups that are particularly affected by local access, including Hispanic children and immigrant children. And then finally, thinking back a few minutes, this really salient group that we really worry about, kids that are facing this triple threat. So they're in low-income families, they have low neighborhood opportunities, and they lack access to Head Start in their neighborhood. Again, we looked at this by race and ethnicity for poor 3 and 4-year-olds and find very big differences in the percent of children that experience this triple threat. So while 15% of white children experience this triple threat, poor white children, 33% of Hispanic children and 46% of Black children. So Hispanic and Black children are either 2 or 3 times more likely than white children to face this triple threat or this triple jeopardy set of conditions. So while that is all a lot to digest and feels, we often get this question of, well, this is helpful to understand, but this also feels so much bigger than me as an early childhood stakeholder. And so what can I do about it? So that really motivated the report that we've been working on for several years that we'll have time to come back to, I think, in discussion. That's about what we call neighborhood informed approaches to early childhood. And so what we did is we spend a lot of time in the beginning explaining, what the neighborhood research tells us about the key issues of racial equity that early childhood policymakers can have in mind when they're thinking about their policies and their planning, but then also went through 5 major federal policy areas. So we did PDGB-5, Head Start, CCDF, public pre-K, and nurse home visiting, and said, well, if we wanted to do something about this, if we wanted to use neighborhood informed approaches, and really integrate that lens so that we could work to advance greater equity in our policies and programs, do we have policy levers available to us? And I think the good news is that, yes, across all of those areas, we do have levers that are available. And so that is really the main point of the report, is to try to outline what those opportunities are to use those. And so we can, I think, talk more about that in discussion.
Erin, thank you so much. This research and work has been deeply influential for NHSA and for me in particular. And I think it really links back to Catherine's notion of, the questions you ask really matter. The data you look at really matters, and your ability to disaggregate this data and show that triple threat and other factors really brings to light the disparities in access and leads us towards solutions. And so just, yeah, really wonderful to have you present that. I'm sure for many folks here, this was new. And I did ask in the chat for the audience, if you want to get engaged, you're feeling a little restless, we've been here an hour, what surprised you so far about what you've heard, and what also has confirmed what you came in believing? Because I find often there's a mix, with a presentation like this. So hopefully you'll find things that were new and some things that confirm. With that said, I'm going to let my colleagues monitor that in the chat, and I'm going to go ahead and share my screen and go back to our findings. So this is our newest and latest effort to look at barriers to access in Head Start and Early Head Start from NHSA. The methodology is here. I won't go into it in depth, but it was about a year of work. And one of the major factors here or pieces of work here was a very large field survey with 2,400 survey respondents from across the Head Start community. Some of you on this call may have responded to it. Thank you if you did. And over 350 pages of open-ended quotes, answers, et cetera. And of course, looking at existing frameworks like Catherine's, like Aaron's work, and talking to experts like Natalie, who was on our working group. I want to go right into what we found were the 7 key barriers to access. And again, this was kind of the first time we've really looked at this systemically since 1994, when Government Accountability Office did a study of Head Start access barriers. Now, the Office of Head Start, of course, collects information, and we had conversations with them, and that was helpful. But here are the 7, and I think why I wanted the other 2 folks to go first is because a lot of this is going to look very familiar based on what you just heard and the things you were saying about Galena and some of the barriers she might face. But it's worth contextualizing them, I think, for Head Start. So I'll do a little bit of that today. Number 1, lack of transportation. There's been a disinvestment, and there are a lot of challenges to maintaining buses, bus drivers, et cetera. And a lot of school partnerships may come and go, right, on that front. That and the outdated geolocation of center-based care in Head Start. You may be in one neighborhood and 20 years ago is highly relevant and not anymore, but it's a brick and mortar business. So how does that shift? How does that change? Various socioeconomic issues. Of course, with Head Start, we're talking about some of our most vulnerable children and families. So what comes with living in poverty? I think we all know pretty well: housing instability, frequent moves. We found an inability to be contacted reliably. A program may contact a family, and then 3 months later, when it's time to actually start or officially enroll, they're no longer reachable. Low income eligibility limits, of course, for Head Start and Early Head Start. Head Start eligibility is deeply outdated and needs to be much more driven by local context, local economies, and those factors. Using the federal poverty rate across all communities in America literally makes no sense. And so we are driving hard on that front. A lack of overall supply. I think Aaron really indicates in particular how that supply can be skewed by race, ethnicity, and other factors. I really want to key in on Early Head Start. There is simply I think dearth is the right word, I'm not sure, a lack of early Head Start slots, prenatal to 3 care, high quality care. We need a lot more Early Head Start. There's actually about 200,000 Early Head Start slots for, I think, 600,000 Head Start slots nationwide. So we have a huge disparity in our prenatal to 5 continuum, even within our own system. Hours of service. This is something Head Start's been working a lot on over the last couple of decades, what was some called duration, but making sure we can meet the needs of working families and we provide the full day kind of full care that most families do want to advance themselves economically and feel supported. The workforce crisis is huge in early childhood. I think everyone on the call probably recognizes that. We know classrooms are shut down. We have data at NHSA. Classrooms are shut because there are not enough workers, there are not enough qualified workers, and they're frankly receiving higher compensation from Target and from other employers. So we're competing with a whole different range of employers. We want everyone to be able to build a career in early childhood that pays them well, attends to their mental health, and is diverse, a diverse staff. There were a lot of surface challenges in our survey work around the lack of dual language, culturally responsive teaching and teaching practices, and knowing that a lot of populations, new Americans, others, dual language learners, are going to be more comfortable and need the supports that a diverse staff can supply. And then finally, we've touched on a parent awareness before. If parents aren't aware of Head Start, what it does, even the simple fact that Early Head Start provides free diapers, for example, what a lifesaver, what a game changer for families. If they don't know that, they may not pursue it. They may not even know about it. And there are some perceived biases that surfaced in our survey, particularly a potential perceived bias for many families around school-based services. Well, if something in the school, it's better than a community-based program. There's certainly some institutional bias that goes on there. For lack of time, I'm going to make sure you all have access to these slides. We pulled out very comprehensive quotes or representative quotes for each of these 7 issues, made sure to code those and to do those in a way that we thought was very accurate. And so I'll make sure you have access to all of these. I do want to at least mention too, like we are also dug into the differential impacts of barriers by race and by ethnicity, not with the same quantitative rigor as the 2 folks who presented before me, but there's a strong intersectional race, income, other analysis that our community does on a regular basis. Not surprising because we have been doing this for a long time in Head Start. And these are a few quotes that I pulled out that I think really speak to some of the exclusionary policies, the way Head Start might be treated differently, and how some of those, including low wages, might be viewed or structural racism, and themselves contribute to the kinds of inequalities in access that other presenters were discussing. There was a particularly, I think, strong analysis of race and intersectionality in the southern states. We did 4 deep dive. We did deep dive work in 3 southern states and 1 state, New Mexico, in the West. And there was just a wealth of information, and some of it quite heartbreaking, to be honest, digging beneath the data, looking at the stories and understanding the real historical divides that maintain and are sustained. And I'm not picking on southern states. We did 3 southern states. We did New Mexico. We will find similar divides, I know, in other states, but for a fact, these are the states that we looked at. Housing discrimination, because we talked a lot about segregation earlier in the presentation, I want to make sure to point out our community is also very aware of how the historical practices of redlining and other discriminatory housing practices have had that long-lasting, long impact on access to Head Start and to Early Head Start. It's the kind of generational shift that I think can happen quickly. It can happen over time, and now we're dealing with the effects of that. So again, I love I think the call to action. I think, Aaron, you made it that, well, if this was done by policy, it can be undone as well. It will take all of us to do that. It's a massive, massive issue, of course. I do want to note a couple. We did ask about underserved populations, and 3 really rose to the top. Again, these are respondents from the Head Start community. Both leadership and frontline staff were really aligned. The top underserved community they saw was the Asian community. They were looking at a range of populations were mentioned, from Burmese to Lao to Vietnamese to many, many others, and noting that perhaps we don't have the kind of engagement outreach practices or competencies to serve those families as well as we should. American Indian, Alaska Native, and then Hispanic were both identified as underserved populations, some due to language, some due to rising incomes, industries they work in, et cetera. So I think it's important for Head Start to recognize this and recognize these disparities, many of which are backed up by some of the data we saw earlier. We are pushing really hard to modernize the income limits, income eligibility in Head Start. And we asked the question a little bit out of curiosity, a little bit because we thought it would be useful. And we asked folks, if we were to raise eligibility significantly in Head Start, would that positively impact diversity in programs? Would it improve and strengthen it? And 7 out of 10 said yes. For me, this was a bit of a surprise for our field. When I showed them this, he said, not surprising. So I think they really understand a lot of families who need Head Start, who are diverse, income diverse, race diverse, family diverse, et cetera, and different businesses, different communities are being left out by our outdated and not modern, right, eligibility standards. So again, NHSA we're trying to be that untiring voice for the field to change those income eligibility limits and standards. So that's our piece of work, our contribution. I think it speaks a lot to, obviously, it's what the community believes. It's also, I think, a lot in line with what we heard earlier today. That said, in our last 20 minutes, I want to pivot us to policy and really focus with our last 20 minutes on family childcare, home-based childcare. We have Natalie Renew here today, and was so excited to bring her because when you look at these barriers to access, we know home-based childcare, family childcare actually literally addresses many of them just by its very structure and how it looks. So Natalie, I'll let you take it away and lead our policy work.
Wonderful. Thanks so much, Kent. It's really a pleasure to be here with you and with Erin and Catherine and everybody on the call. So I'm going to move through this pretty quickly, but happy to come back to anything in the discussion. Just a little bit of background on Homegrown. We're a funders initiative focused on improving quality and access to home-based childcare, and our mission is explicitly inclusive of both licensed family childcare and family friend and neighbor care. I wanted to share a little bit of background on home-based childcare, and for Head Start folks, we're talking about childcare that happens in the home, not home-based Head Start with home visiting. But really want to underscore that lots and lots and lots of American children are having their early childhood experiences in home-based childcare. The vast majority are having those experiences in unregulated home-based childcare. And this is also where a lot of our babies and toddlers are. So just a really large share of children are being served in this setting. And the reason they're being served in this setting is it's because it's what parents want and what parents choose. And parents are selecting home-based childcare because they trust and have deep relationships with the providers who offer that care. There's shared culture, values, language, and practices between the child's home and the home of the provider. This care is accessible and proximate to where families live and work. It's offered to mixed age groups, so families have the convenience of having, siblings stay together. But home-based providers also care for children over many, many, many years and have continuous relationships with those children over long periods of time. This is the form of care that is best able to meet the needs of families that work non-traditional and unpredictable work hours. That's also a population of families that we understand to be disproportionately people of color. And for many families, this is the most cost-effective care. We've certainly seen some changes during COVID. The data is not yet clear, on where this is all going to shake out, but anecdotally, we have seen increased demand and reliance on home-based childcare, and many of the sort of inherent strengths of home-based childcare have sort of been more relevant during COVID in terms of small groups, consistent caregivers, prior relationships with, caregivers and other families, but also the flexibility and adaptability of this program model to meet the needs of families as their employment and other factors in their lives change. This is also the setting in which we see some of the most diverse families being served, some of the families that are furthest from opportunity that we care most about. And it's also the most diverse aspect of the early childhood sector. So, data from across studies shows us that children who work non-traditional hours, children from low-income families and backgrounds, Black and Hispanic children, babies, families in rural communities, and families with children with special needs are disproportionately selecting this setting. And so laser focusing in on this type of care means it's an opportunity to really reach and serve a more diverse population of families. And this is also a workforce that is very diverse. I'm sharing here again a slide from Kent's work, and really I could argue that family childcare and inclusion of family childcare could address all of these barriers, but I want to hone in on a couple. Again, the proximity of family childcare being in a neighborhood itself addresses some of these concerns about transportation and geolocation, the ability to reach families that have not historically been reached by Head Start and who are very diverse, the ability to offer more service to family in the form of childcare that extends into after hours, to work with family child care to increase supply, and also to increase and diversify the workforce of Head Start are all significant opportunities that I see as we think about including family child care in Head Start. So to me, there are two sort of layers of this equity question. One relates to the children and parents who choose family childcare, and how do we ensure that children whose parents choose home-based childcare, who will continue to choose home-based childcare, can benefit from the amazing instructional and comprehensive services of Head Start? And also, how can we ensure that this workforce and the providers in this sector who can benefit from the full cost reimbursement contracts and the incredible supports offered by Head Start, what do we do to ensure that they can participate? How do we advance an agenda to include these providers in Head Start? So very quickly, and maybe a little bit of repeat, I think there are benefits to both home-based childcare, family childcare when they are included in Head Start, and I think there are also significant benefits to Head Start and its system when it chooses to include home-based childcare. And so, you know, on the family childcare side, again, improving reimbursement and compensation, having access to robust supports that have been so well developed within the context of Head Start, being more included in a larger early childhood system like Head Start, and having support for continuous improvement and quality goals are really significant benefits that can be offered to family childcare. There are incredible benefits to the Head Start system as it looks to include family childcare. Number one is the opportunity to enroll a greater number of diverse families, to expand the workforce. I believe very strongly that Head Start has a lot to learn from some of the incredible work that happens in family childcare, especially as it relates to serving mixed age groups, to thinking about really significant looping and continuous care of young children, and the amazing dual generational family engagement work that happens in this setting. This is also a very adaptable program model. We saw this during COVID. As centers and schools and Head Start programs shut down, home-based care was what was able to immediately adapt to meet the needs of families and children. And again, like the startup, the on-ramp can be less onerous, and it can also sort of follow communities and families as they move in communities in more responsive ways. I think there's a real opportunity to think about how spending less money on transportation, potentially less money on facilities due to that proximity, can really allow us to increase investments in workforce and other supports. And I think, again, increasing services to family by getting them more childcare and the kind of childcare that they really want alongside Head Start programming is really significant. I'm not going to get too deep into the strategies here, but I'm going to ask my colleague Karen to put a couple links in the chat. You know, Homegrown is really interested in seeing, you know, more Head Start seats in the FCC model. There are currently about 10,000. I wonder together what it might look like to add another 10,000 in, you know, 2 or 3 years. But I would also just say, as a kind of key strategy, you know, we and many other folks in the childcare sector are thinking about the role of comprehensive networks and networks to really sort of deliver a suite of supports to family childcare providers and the families they serve: quality, sustainability, comprehensive services, and provider well-being. What does that sound like? That sounds like Head Start. So I think there's a lot of sort of alignment between leveraging networks of support for home-based childcare within the context of Head Start. And, you know, there are really two opportunities. One is, how might we support grantees in creating networks of support for home-based providers and including them in their grants? And the other opportunity is, how might we get to know existing networks of support for home-based childcare providers and bring them into the Head Start program? So I think there's a lot to do around this concept of network and really leveraging it as a way to include more family childcare providers in Head Start programs. I wanted to just offer, you know, some of my kind of thoughts about how to move this work forward. clearly there's lots of upside for both family childcare programs, for children and communities and families, and for the Head Start system in general. But this work is going to be very hard, and sort of grappling with what it means to equitably and appropriately include home-based childcare and Head Start is a similar conversation that's happening in QRIS and in the pre-K system. And those are very live conversations. And so sort of my parting recommendations or thoughts and ideas are really to, number one, put families and providers in the driver's seat. I would say, unlike some other, aspects of our early childhood system, Head Start really has the muscle to do this and has a long history of putting families and providers in the driver's seat. I think it's really important that we are prepared to address decades of disinvestment in this aspect of the sector. So the idea that we open the door and all the home-based providers show up and they just start to do Head Start is not fair. They have not benefited from decades of innovation and investment and credentialing support, and we really need to think about making significant investments to get this right. I think there are aspects of Head Start that need to be modified to be more appropriate and more inclusive of home-based childcare. There is a lot we need to do in terms of building evidence and demonstrating when and how and under what conditions this works. And I think collectively, we need to really share these stories and raise awareness around how successful family childcare providers can be as a part of Head Start and how they enhance the Head Start program by reaching more families and really improving Head Start through some different perspectives and some different strengths from that aspect of the field. So with that, I'm going to turn it back over to you, Kent.
Great, thank you so much. I think really what comes through to me when Natalie talks is the mutuality of the family childcare community, of the Head Start community, and how we can do the local work, the hard work, to make those partnerships happen and to serve more children and families with the highest quality possible, including diverse and at-risk children. So I love your vision and look forward to continued work with Homegrown and other partners on that. We are in our last 5 minutes. We've just hit the tip of the iceberg on policy. You've heard a lot today. And I want to turn back to both of my panelists for any closing call to action. I like to end all our calls with folks saying whatever they want. It can be personal, professional, whatever you want, to our audience as we depart from our virtual world today into our real world, hopefully, or to another Zoom call. So, Catherine, why don't I start with you? What's your call to action for our listeners today?
My call to action is so basic, but it's to listen to families and what they want. I think, and maybe I'm so biased as a researcher to say that since I don't have the privilege that many of you have every day to talk to families, I don't have that privilege. But to if you have that knowledge of what families want and need, let's develop better ways of sharing it from their perspective.
Kudos, wonderful call to action. Erin, what's your call to action?
I was trying to decide between three, but I'm going to go with, I think just all of us making an intentional effort to make racial equity like central to the work that you're doing. So make sure that issues of race equity are not getting compartmentalized as a separate issue. So for example, when we're talking about the level of underinvestment in the system overall, that's a race equity issue. That is like a massive overarching issue. So just making sure that, they're showing up in every level and part of the system, and just making sure that they're made central so that they don't get put in a separate, box into the side. So, and also emphasizing like the extent to which we are all harmed by our continual kind of failure to address issues of race equity at a larger scale.
Definitely, our children are harmed by that. Natalie?
I guess I would sort of piggyback a little bit on Catherine's and just say that I think providers and home-based providers in particular have incredible expertise to contribute to this conversation. And I believe that their commitment to families, the fact that they're willing to work 55 hours a week to care for kids and to show up on day one of a global pandemic, you know, with their doors open, and to build really deep and sustained relationships with families means that they need to be at this table and helping us really understand what they need and what the families they serve need and how systems can be more responsive to them.
Awesome, thank you. Well, I'll end with my call to action, which is we've received a lot of good resources today from the framework, from Child Trends, from the reports that Natalie and team have put in, to Erin's deep research and knowledge on access by geography, race, ethnicity, and other factors. I hope you'll use at least one of these things in the coming weeks, that you'll find something here, even if it's an idea or the framework, which is very simple to use in your work. I see folks are putting some of their emails in. Erin, thank you so much. Natalie and Catherine, if you are willing to do that, please go ahead and do that too. I hope you'll use something from this call and recognize that you have the power to look locally, to think locally, and to think and act locally to remove barriers to access, make your programs, your high quality programs, even more accessible for more children who need it and children and families. So you have the power. That's my call to action. And with that, thank you all. And please join me in the chat thanking our panelists today. They put a lot of thought into this work, as you can tell, and they've done literally decades of work on this. So appreciative of them. The thank yous are rolling in. And thank you, Catherine. Thank you, Erin. And thank you, Natalie. And I hope everyone has a great rest of their day. Stay in touch. Thanks so much.